Okay, great. Thanks everyone for joining and welcome to our webinar on the WASH Systematic Map, which is a new innovative map that looks at how achieving WASH outcomes is associated with higher level development goals. So I'm Sridevi Prasad. I'm a senior research associate at the International Initiative for Impact Evaluation, or 3IE, and I led the development of this map, and I'll also be the moderator for today's session. So just some housekeeping rules as well as the agenda. So we will have some opening remarks from our colleague at USAID, and then we'll have a short presentation on the WASH systematic map and its findings with a short panel reflecting on the map, and then we'll open it up to Q&A for about 15 minutes before closing the event. So if you have any questions during the session, please enter them into the Q&A box, and please also indicate who you are directing the question towards. So when we get to the open Q&A, we know who to answer. So this map was produced as a part of the USAID Bureau for Resilience and Food Security Evidence Aggregation for Programmatic Approaches, or REAPER project. So I'm going to introduce Nikki Benke, who will be providing opening remarks. So Nikki is a water and sanitation advisor at USAID Center for Water Security, Sanitation, and Hygiene. She focuses on Middle East mission support and is the Washington point of contact for improving coherence across humanitarian, development, and peace approaches to WASH and water resources management programming. Prior to USAID, Nikki was a WASH researcher at the Water Institute at UNC and has field research experience in Malawi, Zambia, and Jordan. She has 7 years of experience in the WASH sector and has an MSPH in Environmental Sciences and Engineering from UNC Chapel Hill, where she focused on WASH and environmental health conditions in protracted displacement. Okay, over to you, Nikki.
Thanks so much, Davey. I really appreciate the introduction, and also thank you so much for inviting me to participate in today's webinar and panel. As Davey mentioned, I work for the Center for Water Security, Sanitation, and Hygiene, which sits in USAID's Bureau for Resilience and Food Security. And I'm going to frame my remarks with a definition here. So the term water security, sanitation, and hygiene. This may be a bit of an unfamiliar group of terms for those of you who are familiar with water, sanitation, and hygiene, WASH. But when I say water security, sanitation, and hygiene, or as some people like to call it, WUSH, I am referring to both WASH programming, but also water resources management. And we're focusing on water security for all of its uses, from the kind of WASH household use to industry and agriculture. So this is kind of a broader term, and I may use water security, sanitation, and hygiene interchangeably with WASH and water resources management, or WRM. So all that being said, as you may know, the global water strategy is really the US government's North Star when it comes to global water security. And the latest iteration of the strategy was released last year in October. And the overall goal of the strategy is to improve health, prosperity, stability, and resilience through the sustainable and equitable water resources management and access to safe drinking water, sanitation services, and hygiene practices. That's a lot of words, and oddly enough, the word that I'm going to ask you to focus on is the word through. The reason is that this wording really reinforces that WASH and water resources management programming is not an end in and of itself. It's not the end goal. It's really about its connections to these higher level outcomes of health, prosperity, stability, and resilience. The strategy also has 4 operating principles, which are sort of the core values that will guide USAID water and sanitation investments. And one of these principles I wanted to point out is to leverage data, research, learning, and innovation. And that highlights really how integral evidence is to everything that we do at USAID. So we saw this opportunity to collaborate with 3IE on this evidence map as really a concrete and useful way for us to walk the walk in terms of our commitment to data and analytics and decision-making for evidence-based programming. So specifically, this tool really allows us to understand the connections between WASH and WRM programming and the broader development goals that connect back to the global water strategy that I already mentioned. Also wanted to flag that this tool really complements the work that USAID is already doing to bolster the evidence base in WASH and WRM sectors. And that includes the Global Water Strategy Action Research Initiative, which I would encourage you to check out. There's a website for it on Global Waters. And really just kind of to conclude, this map will really be a crucial resource for our team in both Washington, but also in missions. And we hope for implementing partners as well as we think through how we can tie WASH and WRM programming to broader development objectives. So I'll hand it back over to Davy. Thank you so much.
Thanks, Nikki. That's a really helpful framing. So now I'm going to pass it over to Heather Van Buskirk to present an overview of the systematic map and findings. Heather is a research associate at 3IE, where she co-produced the WASH systematic map. She holds an MSc in Impact Evaluation for International Development from the University of East Anglia and previously worked as a development practitioner in Southern Africa. Perfect.
Thanks so much. Let me get my PowerPoint up and running here. All right, are we on screen? Great. Well, thanks so much for attending today, everyone. Good morning or good evening to you in your respected time zones. I'm excited to jump in and give you a little introduction to our map. So yeah, starting right off, this is our WASH outcome to outcome systematic map. And you may ask, what is a systematic map? Some of you will be familiar with evidence gap maps developed and pioneered by 3IE. A systematic map is somewhat similar in that it makes the entire research base on a given question available in an interactive format. And uses the same systematic search and screening processes we use for our evidence gap maps. But systematic maps may differ in that they may use an alternative framework or include a broader range of study designs. Our map is different from EGMs in both counts. We have an alternative framework and we use a broader range of study designs than our typical EGMs. In the case of this map, we believe it's quite innovative as it's the first outcome to outcome map that we are aware of. It's using this innovative outcome to outcome mapping approach. And so the overarching question we're attempting to answer with this study is when improvements in drinking water, sanitation, and hygiene are realized, what do we know about the association between these WASH achievements and high-level development outcomes? So we set out to map all the research that answers this question about the association between these outcomes. We don't delve into the findings of the individual studies. We want to give an overview and an interactive way to interact with these studies that we found. So a brief and very generic theory of change that we developed for WASH outcome mapping is shown here. We have our intermediate WASH outcomes in dark blue, and we're looking at how these outcomes may contribute to higher level development goals in prosperity, they're in green, stability outcomes in gray, and resilience outcomes, they're in light blue. Now, much of the WASH literature, particularly the impact evaluations and synthesis that 3I typically works with, focus on the links between WASH interventions and health. Many of you will be familiar with the WASH literature that focuses on enteric diseases or sometimes nutritional outcomes. Much of it is focused there. And we have an entire separate EGM that maps many of these associations and studies. We can share a link to that with you as well if you're interested in that. But we are looking to take a different and innovative approach here to look beyond WASH interventions and health to these further longer term or higher level development goals. So this map is a little bit different in that it's intervention agnostic. So we include any study that includes our outcomes of interest, whether or not a WASH intervention takes place, or if no intervention takes place and the study is just comparing states of pre-existing WASH infrastructure or services. So we're starting from a point of WASH achievements and investigating the links to higher level development goals beyond health. And we believe that this completed map is an excellent starting point for further research testing these relationships between the various outcomes. Excuse me. So the two main categories of WASH outcomes that structure the map are grouped according to the Center for WASH's strategic approaches or development results that are outlined in the Global Water Strategy. So our drinking water outcomes in the first WASH category range from drinking water systems and their oversight on the macro level down to individual practices surrounding drinking water. And since the focus in this category is explicitly on drinking water, we excluded studies that did not disaggregate drinking water from other water sources, such as industrial or agricultural water, as well as non-potable and unimproved sources of drinking water. For improved and unimproved levels of WASH, we're using the Joint Monitoring Program's definitions of improved and unimproved sources. In the sanitation category, our sanitation and hygiene, these outcomes also range from institutional services down to individual practices. And this category excludes studies, again, of unimproved sanitation, a wastewater treatment that doesn't involve sewage, or oral or dental hygiene. Those are excluded from this category. And now the high-level development outcomes, we're looking for the associations to fall into three main domains. As Nikki kind of introduced us to earlier, beyond health, we're looking at accelerating prosperity, which are the outcomes that improve productivity and allow businesses, markets, economies to grow. We're looking at the scope of this category covers, again, individual and household level all the way to macroeconomic indicators. Our stability outcomes aren't limited to government per se, but we take USAID's broader view of governance, which would include public, private, and social institutions, actors, systems, and processes. Our resilience outcomes are based on USAID's definition of resilience, which is the ability of people, households, communities, systems, and society overall to respond to shocks and stressors. And to keep these outcomes focused on that resilience, the idea of responding to shocks and stressors, within this category, in the context of this map, our resilience outcomes are restricted to climate change related stressors. So the first three outcomes within this category needed to be explicitly mentioned in the context of climate change. The pollution outcomes didn't need this explicit mention of climate change, but needed to measure pollutants in the environment or the ecosystem to identify the relationship of WASH to improvements in the quality of the environment. So for expanded definitions of any of these outcomes, the WASH or the high-level outcomes, you can explore the map. If you click on each outcome in the map, an expanded definition will pop up, and we have much more detailed definitions included in the report that accompanies the map. So moving on to methods, how did we actually produce this map? It was quite an involved process. Some of you may be familiar with our screening criteria we typically use for our EGMs, which uses a PICOS acronym, which involves other criteria for interventions and comparators. Those weren't applicable to this map, so we adapted the PICOS screening framework to the PIES screening framework, which we've termed it for this map. So as we screen each study, our team of reviewers applied the following inclusion criteria in hierarchical order. They would start out with the year of either the data that the study used to assess WASH, or in case the year the data was collected wasn't available, we'd use the publication year. And we were limiting the scope to more recent studies, so from 2010 or later. The population criteria was limited to results from low and middle income country populations. If studies also reported results from high income countries, they needed to report the results from low and middle income countries separately so we could determine the outcomes in those contexts. For our WASH outcomes, the studies obviously needed to include one or more of our WASH outcomes of interest. Caveat here was they needed to affirmatively measure that the WASH outcome was present and realized if the study was focusing on the absence of WASH, so the effect of, poor quality drinking water, unimproved sanitation facilities, those were excluded. That wasn't what we were looking for there. On the high level outcome category, Studies had to also concurrently measure a high-level outcome along with the WASH outcome. So they didn't need to demonstrate that the high-level outcome had been achieved necessarily. We accepted, positive, negative, or null associations, but the outcome needed to be measured in some capacity. For study designs, we included studies to impact evaluations, systematic reviews, and quantitative observational studies. And to complete the outcome to outcome mapping exercise and to make sure studies were actually examining the association between our WASH outcomes and our high level outcomes, the mapping and the screening required a further criterion beyond study design. Our screeners had to determine whether the studies were actually quantifying the association between our two sets of outcomes. So for practical purposes, this means that most of our included studies are quantitative observational studies that use regression models to show this relationship, as well as impact evaluations that are able to show a causal relationship between WASH and these high-level outcomes of interest. If studies were qualitative or purely descriptive, they were excluded. Our colleagues at MIT built a machine learning model for us that helped us narrow down our pool of studies on date and the WASH criteria. And then we had a team of human reviewers that double screened each and every study on title and abstract, and then on full text. So it's quite an involved process. What we found at the end of the screening process, we started from an initial pool of over 41,000 studies. And through the screening, the title and abstract full text, studies were most commonly excluded because either they didn't measure a high level outcome or didn't use a specified study design. Other reasons, of course, as well, but those were the two primary reasons for exclusion. And in the end, a map includes a total of 279 total studies, 49 impact evaluations, 19 systematic reviews, and 211 quantitative observational studies. Breaking these 279 studies down by publication year and study type, we found that most of our included studies were published between 2016 and 2021, with a pretty large jump between the years 2015 and 2016. There's a lot more research coming out in this space within that time frame. The few studies you see here for 2022 is more of an effect of the timing of our search. We ended our search for studies in May of 2022, so that's more reflective of the timing of our search rather than the actual volume of literature for that year. More is being published all the time. As far as the breakdown of study types, we identified many studies that identify the links between our outcomes, but the vast majority are quantitative observational studies. So these use methods which can only identify the correlation between outcomes and not a causal relationship. We only found 49 impact evaluations that use appropriate research designs to identify the causal relationships between WASH and the high-level outcomes. And the majority of these impact evaluations were published within the last decade. So it is more of a recent trend that we're seeing the causal research emerge in this space. As far as geographic distribution of the studies, at the country level, we find that Kenya had the most studies with 40 studies, followed by India with 36 and Ethiopia with 33 studies. We find a good coverage across all of our low and middle income country regions. There's no region of the world that was excluded from the map. And we do have a few high income countries on the map that made it in if they were included in multi-country studies along with our low and middle income countries. By WASH outcome, we find that the most frequently studied WASH outcome was increased access to enhanced drinking water with 91 studies, followed by 71 studies examining the access to sanitation and hygiene. These were explicit goals of the Millennium and Sustainable Development Goals. So we found that was an unsurprising finding. We anticipated seeing a lot of research on those outcomes in particular. We also note that very few studies looked at the safe food hygiene WASH outcome. We've included another category on the map here at the bottom of the frequently combined WASH. And these were just the top 3 combinations of WASH outcomes within studies that we identified. So most commonly studies may look at, access to water, drinking water combined with access to sanitation, hygiene. That is a frequently occurring combination of these WASH outcomes. By high-level outcomes, we find that most of the research was focused on the prosperity outcomes, followed by our stability, and then, of course, the resilience. This is probably more of an artifact of our screening criteria, which required that the resilience outcomes be mentioned in a context of climate change. So that's some of the effect of the limited studies, but it may also be an under-researched area. It's something to look into more in the future. We find that 75% of the studies in the map are concentrated among 3 of our primary high-level outcomes, being education with 92 studies, livelihoods, 97 studies, and public perceptions of institutions. There are 99 studies that involve that outcome. For the education and livelihoods, we find that often education status or indicators like income or assets are used as covariates and regression models. So they frequently pop up in the literature. They may or may not be the primary high-level income that's being investigated, but they're often in studies kind of as an artifact of those control variables that are used in regression models. Among the public perception of institutions, a lot of these studies examine willingness to pay, which we use as a proxy for people, paying for services, kind of a vote of their confidence in institutions. There are many of those studies within that category. And within resilience, most of the studies in that domain are focused on the pollution outcome. Again, very few looking at the climate-linked outcomes. And we found no studies, 0, none, that examine WASH outcomes in relation to climate-linked migration. So that does appear to be an understudied area. When we break down the high-level outcomes by WASH domain, we find overall that our drinking water outcomes in order of frequency are primarily associated with the public perceptions of institutions, livelihoods, and education, while most of the sanitation hygiene studies were associated with education outcomes, livelihood outcomes, followed by public perception of institutions. So the same outcomes, a little different order when you break it down by the WASH category itself. When we come to the implications, just a reminder that we didn't look at the findings of any of these studies. The map just displays the coverage of the studies according to the outcomes. So what we're looking for is where there are concentrations of research so that policymakers and practitioners can refer to inform practice, or where there may be gaps in the research base where it may be worth further inquiry for program learning. And among the WASH outcomes, we find that each WASH outcome was represented within the map. There weren't any that were absolutely missing there. But most studies there focused on access to drinking water, access to sanitation, hygiene, or there's also a cluster among the menstrual health and hygiene studies. We did find a significant gap there among the safe food hygiene studies. There are only three studies that examine that WASH outcome. And it may be because this aspect of WASH is under-researched, or it may also be because the theoretical links between something like food hygiene and these higher level outcomes like governance are a bit weaker. There's not an unnecessarily obvious connection there. So it's something to consider. Among the high-level outcomes, we find the main clusters in education, livelihoods, and public perception of institutions for some of the reasons I mentioned earlier, with the education livelihoods being common in some of the models, covariates in some of these models we use. And we have identified some large gaps among the climate-linked outcomes. Again, absolutely no studies on climate-linked migration. And some of those resilience outcomes may be an artifact of the screening criteria, or maybe an area that bears further inquiry in the future. As far as the geographic distribution, generally we find studies across all world regions. We find a definite concentration of studies performed in East Africa and South Asia, and relatively few in Eastern Europe or the Caribbean. And when it comes to methods, we find that most of the studies we included were observational studies. So there is a bit of a limitation there, that these only show an association or a correlation and don't have that causal inference that may be helpful. So that's a gap that could be pursued in the future to identify more of the causal links between WASH and these high level outcomes. We also find a lack of high confidence systematic reviews of the 11 systematic reviews in the paper. Only one is high confidence, one medium confidence, the rest are low confidence. So you need to be careful in interpreting the results of those studies. And where we find many of these concentrations of studies are the clusters among the WASH outcomes and high level outcomes. In comparison, there's a relative lack of synthesis of those clusters. So where those clusters of primary studies exist, but there is not a corresponding systematic review or piece of evidence synthesis, that represents an opportunity for further research to really bring that together and find out what can we conclude about what's the research in this space and what do we really know about the links between WASH and these higher level outcomes. So some food for thought. Those are our main findings as far as the distribution of the research. And now we're gonna open it up for some discussion. But first and foremost, of course, I can't forget, we just say like a big thank you to everyone who made this map possible. So everyone from our USAID partners, Nikki, you and your colleagues who advised on the scope of the map, our advisory group, which helped us develop the outcomes and our screening criteria, the ML team who helped us put together the models that screen the results, and all of our human screeners who did a fantastic job screening the studies and extracting the data so you can have this wonderful map with very helpful filters. You can narrow down the results by country and location setting. It's all because of their hard work. So thank you so much to the screening team for all your efforts on this. We're very appreciative. Thanks so much.
Great, thank you so much, Heather. That was really helpful. And so I think to reflect on this map, we're going to have a short panel discussion with Nikki and another colleague, Carolyn. And so I actually also remind people that to please, if you have any questions, please add them into the Q&A. And please put who you're directing that question to. So I want to introduce my colleague, Carolyn Wong. Carolyn is a senior evaluation specialist at 3IE, where she leads several research initiatives, including our REAPER portfolio. She has over 10 years of experience working on research covering social protection, poverty alleviation, maternal and child health, and modern slavery issues. And Carolyn holds a PhD in public policy from UNC, an MPP from American University, and a BA from the University of Michigan. So my first question to both of you is reflecting kind of on the presentation we just saw. So do any of these findings resonate with you? Did you find any of them surprising? And Nikki, I'm going to pass it over to you first to answer.
Sure, thanks, Davy. Yeah, it's something I wanted to kind of start off with is based on decades of research, we already knew that there was a well-established link between access to WASH and then health outcomes, particularly for children under 5. But the focus on these higher level outcomes of prosperity, stability, and resilience is really innovative, as Heather mentioned. So I just wanted to give kudos for the innovation there. The fact that there's a gap in research around direct linkages between WASH and WRM and then the higher level outcomes within causal frameworks was not particularly surprising. Part of this is just due to the complexity of each individual context. You know, it's nearly impossible to attribute all or even a portion of improvements in these higher level outcomes to WASH programs and interventions directly, because ultimately the world is not a laboratory, so we can't control for all of the different variables. But that being said, there is some exciting research that we're kind of surprised to see around linkages between WASH and WRM and prosperity, and specifically sort of in the livelihoods and education space, as was mentioned. And even though these were mostly observational studies, this suggests that there's at least a little bit of momentum that might lead to higher confidence research in this area. So it's promising to see this as a kind of starting point for maybe some burgeoning research areas.
Yeah, thank you. I think especially like seeing kind of the trend of research and seeing there's been more focus on these outcomes has been really exciting to see. So Carolyn, I'm also going to pass the same question to you about kind of what findings resonated, as well as what did you think was surprising?
I think in general, my observation was that some of the intermediate outcomes that are more distal to the higher level outcomes, seeing gaps in those were unsurprising. And likewise, seeing that we have more evidence on outcomes that are directly linked to population level intermediate outcomes, like access to drinking water, sanitation, and access to sanitation and hygiene, uptake of hygiene practices. It's unsurprising that we then see more of this literature represented within the map. I think there were some other small thoughts that I had that, the cluster of evidence between menstrual health and hygiene outcomes and education-related outcomes, like school attendance and absences, were not really that surprising because these tend to be outcomes that are targeted by menstrual health and hygiene programming. And then finally, I guess some surprising findings. I was a little bit surprised by the lack of evidence on systems, institutions, and delivery mechanisms related outcomes. So for instance, water utility, consumer relations, sanitation, and hygiene management, facilities, enabling environments. I think this goes back to my comment about the causal pathway and where we are, and whether it's the distance is really far between the high level outcome, maybe the mode of delivery or the enabling environment is too far to observe literature about those impacts. But at the same time, as we think about sustainable development, I think we have to think about the importance of institutions and systems level actors. And so that was surprising. And then finally, in terms of the lack of climate linked outcomes, that was also surprising. I think, most of the map was driven by some inclusion criteria that required the studies to explicitly mention climate change. But most studies did not do this and talk explicitly about what is become a salient issue for the global development community. I think there's more evidence that needs to be generated. Oh, maybe I'm going into the second question, but just to say that there needs to be more relating to the examination of climate change affected contexts and resilience, and in particular where the achievement of WASH outcomes fits within this broader complex system and theory of change. Okay, thanks.
Thanks, Carol. Yes, you are actually going into our next question, which is very helpful. And I think I asked kind of thinking about these gaps that you found, understanding, and we're trying to use research to be able to guide decision-making, kind of what areas do we need to focus on generating more research within the WASH sector, and where does the research base need to grow? So first I'll pass it to Nikki.
Yeah, thank you. I think something that really stuck out to me, and this was highlighted in the brief, was the gap in research focusing on marginalized populations, including Indigenous people, displaced populations, and disabled populations. This wasn't especially surprising, but it is really concerning, especially considering that, inclusive development is really at the core of what USAID does, and hopefully the rest of the development community as well. And the thing is, if we don't actively prioritize these populations in our research, that threatens not just the equity of our interventions and programming, but also the effectiveness of it. And then when it comes to research on prosperity, stability and resilience outcomes, it's less about the research and more about how it's framed. At this point that I'm going to make, we need to be able to communicate effectively to decision makers. Like, what does this actually mean? So, being able to say, as a result of increased access to WASH, local purchasing power could go up by X percent, or X amount could be avoided in humanitarian setting. So that would tie to resilience. So that's another step that's really hard to get to. There's a pretty significant amount of effort and research that would be needed for that. But ultimately, for trying to make the case for WASH to decision makers, I think that framing and that kind of communication style is really important. And then last thing I want to point out is, there's these higher level outcomes that are really important, but there's also a need for more implementation research. The high level impacts that we've talked about are really important for making the case for the centrality of WASH and WRM to development. But there's also the importance of making partners' policy and programming more effective, and USAID has been investing in filling those gaps in implementation research through our Action Research Initiative. And we definitely can't do it alone and need others to join us.
Yeah, thanks for that. I think especially at the point you raised, about the lack of research focusing on marginalized populations, especially they're trying to move towards meeting, SDG 6 and like ensuring no population left behind. And also going back to Carolyn's point about thinking about WASH systems and investing in WASH systems, like we need to ensure that it's not just focused only on the mainstream, but also bringing in other populations. So Carolyn, I think you've already started to answer this question, but I also want to pass it back to you on kind of like where, from a research perspective, do we need to focus?
Yeah, I talked about some of the gaps, in particular relating to institutions, systems level actors. I think as the development community increasingly invests more in strengthening WASH systems, it's going to be important for us to understand how exactly that translates within a more complex world where, yes, we are focused on high-level outcomes like prosperity, stability. And I think in general, the fact that the study only found 49 impact evaluations, so like rigorous evidence that's explicitly trying to examine this causal relationship suggests that there is a need for more research. And we know that the gaps, we know where the concentrations of evidence are, but we know that there are many more gaps. And in order for us to be able to make a strong case and communicate, we need to be able to say that exactly how achievement of these WASH outcomes contributes to the broader development, addressing broader development challenges. I think my final comments, just thinking about as we continue considering how to support WASH systems, we also need to understand how improvements in WASH affect other important dimensions of development as well, like transparency, accountability, participation, and inclusion of communities that are particularly affected, and especially as climate change is exacerbating these issues. And so we need to understand better overall if we're making improvements across the system, and not just at the utility, but looking at improvements. So yeah, that's it on my end. Thanks.
Thanks. Yeah, I think that's really important to think about. And I think reflecting on this map, and it's also kind of the research and kind of we think about these gaps as well. Moving forward, how should we think about WASH programming and its implications? And so I'm going to pass over to Nikki first.
Yeah, thank you. And I think something, coming from academia prior to my time at USAID myself, I wanted to just reiterate that consolidating all of these studies into one brief and evidence map and visual was honestly just a remarkable feat. And the visual itself is such an important starting point, because, at USAID, we love to have plenty of 100-page reports that are really difficult to digest, and just having the visual is so important for being able to communicate more effectively about the evidence. And it also gives WASH researchers a really great starting point for when they're making decisions about where and how to prioritize future impact research of interest to the agency. It also prevents duplication of effort in terms of research focus areas. And unfortunately, that's really crucial because resources are very limited, and it makes sense to try and not duplicate those efforts. And I think it also gives us really the visual gives us a clear call to action on where we need to learn more. Understanding the linkages between WASH, WRM, and prosperity, stability, and resilience isn't only important for effective programming, but it also helps us make a stronger case for more resources to tackle WASH challenges worldwide. So kind of a vague answer, but I just wanted to reiterate how innovative and important this visual and the brief and report that come along with it are for giving us a really useful evidence-based starting point for decision-making and future research.
Thanks, Nikki. Yeah, I agree. Like the call to action, I like that framing. So I'm also going to pass to Carolyn and kind of think about also kind of what your call to action would be for us.
I mean, I think Nikki said it well. This was really a first starting point. We really need to continue thinking about how achieving WASH outcomes contributes to the achievement of these broader development goals, and acknowledging that development needs are multifaceted, dimensional, and sectoral. And I think this is a really great step and could be an example, actually beyond just to the WASH community, but to the development community broadly, who are very siloed in their sectors. But I think, Nikki raises a really good point that we need to start having other conversations with other sectors, and we have to think about the intersectionality of development challenges. So in particular, how does we could think about how does achieving WASH influence women's empowerment? We could do a lot more on unpacking, the impacts on livelihoods, and similarly for governance. And I think this could establish a case to show that WASH should really be integrated. We talk about WASH as a fundamental, kind of like a fundamental component of development, possibly even like a human right. And I think, when we think about how we leverage this map, it establishes that case. I just last point, I think that, this map does help us think about the call to action. Similarly, there are other initiatives like the recently established Lancet Commission on Water, Sanitation, and Hygiene that is similarly calling for the community to reimagine and reconstitute WASH, just not just as a pillar of public health, but also that pathway to gender equality and social and environmental justice. So certainly, these efforts could be leveraged in a similar way.
Great, thanks so much. So we have some questions in the Q&A that I'll bring up. And so the first question I'm going to hand over to Nikki is, there's a question from Mark asking, how does USAID plan on using this research map for future programming?
Yeah, and I kind of touched on this in my last answer, but really this is just such a crucial starting point. And I think, honestly, when we're thinking about like training new WASH leads at missions, or because we don't have, at USAID, we don't have a WASH backstop for the Foreign Service. So, just this is such a crucial resource for someone who might be coming from more of a health or environment backgrounds to be able to understand, okay, this is the state of the evidence. And it specifically links it to the global water strategy, which is, as I mentioned, sort of our North Star for all WASH and WRM programming. So I think that's one way I see it being used, but I also see it sort of provoking further conversations and about where we can build on this and continue to try and make that messaging that I was mentioning about for that will really resonate with decision makers, because, as WASH practitioners, we would love to have all the resources in the world, but we're ultimately not the ones who necessarily make that decision. about how much is invested in WASH. So it really helps us to be able to say, this is how it affects these high level outcomes that are prioritized, not just by the Center for Water and the extended water team at the agency, but also the entire US government. And I think that's an important note, is that, you know, Global Water Strategy has 15 different agencies that are signed onto it and have written their agency plans under it. So it really just helps us make the case for WASH is central to development and humanitarian programming.
Thanks. And then a question for Carolyn. So somebody asked, you mentioned the importance of institutions and policy and systems change, which seem more complex to evaluate. What are some ways you can measure impacts for interventions that are looking at these type of changes?
That's a really good question. So, I mean, there certainly impact evaluation methods are one method that could be used to evaluate. But I mean, I would encourage, you know, any future work on this to expand and consider other methods that are less attributory and might also include contribution tracing and accounting for different factors that might be affecting impact. But yeah, really good question. Thank you.
Great. And so Heather, I actually have two questions that relate to the map inclusion. So one question was looking at if the research looked at any private sector involvement that proved any of the outcomes we saw. And the second question was asking if it's possible to separate interventions that look at household behavior, like household filters or CLTS, versus the more infrastructure-based interventions like piped water and sewer connections.
Okay, I'm back. Sure, for both of these very specific questions, it might be helpful to, let's see, take a look at the map and see some of the functionalities it has. We didn't get a whole lot of time to walk through the actual map within the presentation, but some of your questions are probably addressed by looking at specific WASH categories themselves. So some of these involve, you know, like management and oversight of systems, of drinking water systems, sanitation systems. Within that category, you'll find some of these are public systems and some of these are privately managed sanitation and drinking water systems. So I'd recommend taking a closer look at those studies. As far as, pardon me, what was the other question about
It was like separating households. Yeah. So really household level interventions from like more systems level interventions.
Yeah. Yeah, so like we said, we didn't look at interventions themselves, we're just looking at the outcomes. And some of these are on more the macro level, looking at community level, regional level systems, whereas some of these are individual water and sanitation practices. So again, within the outcomes itself is a good place to look. We also have some filters here where you can look at settings. There's rural, urban locations. There's specific locations, so you can look at WASH within businesses. So some of those may relate to some of your private sector questions, healthcare facilities, schools, other locations, things of that nature. Yeah, and just for anyone, when generally you can filter the map according to maybe specific vulnerable populations. You can look at geographic locations. Any specific topic of interest or focus you have within the WASH community, I'd recommend just playing around with these filters a little bit and then engaging with the studies that come up in the results.
Great, thanks, Heather. So we also had kind of common kind of question come up in the chat of kind of how can we take this research and think about how to make it into more practical, actionable content? And so I'm going to pass it over to Nikki to answer that as well.
Yeah, I think, you know, academics, and I'm speaking as a former academic myself, and also just development practitioners in general, something that the commenter mentioned was, you know, this is all just development speak, which is a very fair point. And we constantly have the refrain of, these are the research gaps, we need to invest more in research, we need to, it's just like a never ending cycle. There's always more that we can learn. But the thing is, you know, when you're designing a program, there are gaps in research that make it really difficult to justify, this is how this links to prosperity. This is how this links to resilience. And like I was mentioning before, ultimately decision makers' priorities change, with not just administrations, but also just the times. Now there's this huge focus on climate, which is fantastic. It's really exciting to see. But, our job is partially to link the work we're doing to climate now. And if there's a gap in research, there is a bit of a gap in research there about linkages to WASH and WRM, then it makes it really challenging for us to continue to advocate for ourselves as a sector and to get continued resources to be able to really effectively have sustainable change. And then also, something that I wanted to point out again is just, this is pretty innovative, actually focusing on the impacts on stability, resilience, and prosperity. That's new. We have plenty of information about how WASH directly affects health and impacts, and there are still research gaps there, but this map is filling a really significant gap that's really crucial to US foreign policy. So just wanted to leave you all with that thought.
Perfect, thanks. And that's actually, I think we'll kind of move from I know there's a couple more questions in the chat or the Q&A we're able to get to, but I do want to, we're getting close to the end of time. And so kind of move on to our closing remarks. And so just for Nikki and Carolyn, I'll ask you both to kind of just give kind of like a short, last, whatever you want to say before we close out. So Nikki, go ahead.
Sure, thank you. And thanks so much for having me today and for organizing this webinar. I'm really excited about the opportunity to promote what I have mentioned is a really innovative and exciting product. So, but yeah, ultimately, at USAID, we're doing what we can to leverage technically sound approaches and have sustainable long-term impacts on people's lives in the communities where we work. But another important component that I think is sometimes neglected is we also strive to be responsible stewards of taxpayer dollars. And understanding the state of the evidence is a necessary condition for achieving both of those objectives. And this evidence map is especially useful in the context of the global water strategy, which specifically calls out the linkages to these higher level outcomes, as we've discussed. And this tool shows us what we know, but arguably more importantly, what we don't know about these linkages, and it sets us up for more deliberate and thoughtful approaches to future research and implementation in the WASH and WRM sectors. And yeah, just wanted to thank 3IE for this really exciting and useful work and for hosting this fantastic webinar.
Thanks, Nikki. On to you, Carolyn.
Yeah, thanks, Davey and Heather, for hosting as well. I think having worked on the resilience evidence gap map as that's part of this project as well, I think this was a really important contribution, and it can be an example to future efforts and to think about what is the evidence base and what are the relationships in a broader theory of change when we're trying to achieve development outcomes that are really complex and interconnected. And so I think, this could be an example to other sectors to consider thinking beyond the silo of their sector level approaches and really start thinking about how solutions can be interconnected, because we know that in reality, development challenges are not usually just one dimensional. And we know that it is some problems can be addressed with a single approach, but many are deeply entrenched. And for those reasons, they're systemic and very hard to address. So I think, a great next step for researchers is to really consider if this could be applied in other sectors and really try to bring together the evidence base so that it's a little more coordinated and it's, and actors are talking across each other. Thanks.
Great, thank you both. And thanks everyone for joining today. We want to, again, thank USAID and our colleagues, and especially want to give a shout out to Brian Banks, who is Our primary point of contact, the Center for WASH, did great support and giving great leadership during this process. I also want to encourage everyone to check out the map, read the report, read the brief, reach out to us if you have any comments or feedback. We're always interested in that. And thanks so much for joining today. Thanks. Bye.